Sa mundong sabi, sa pagkakapantay-pantay, ilagak ang bukas sa iyong mga kamay. Sa bawat salitang sambit ng iyong bibig, sa mga nangangarap, pag-asa ang hatid. Ito ang panahon, higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapisik. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Mahirap at tila walang katiyakan. Pagkatutoy tubig, hahanap ng daan. Ang liwanag ng mundo'y ating kaisahan. Ano man ang dahilan, pag gusto'y may paraan. Ito ang panahon, higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-pising. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Gurong Pilipino, mabuhay ka. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Sa mundong sabi, sa pagkakapantay-pantay, ilagak ang bukas sa iyong mga kamay. Sa bawat salitang sambit ng iyong bibig, sa mga nangangarap, pag-asa ang hatid. Ito ang panahon, higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapisik. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Mahirap at tila walang katiyakan. Pagkatutoy tubig, hahanap ng daan. Ang liwanag ng mundo'y ating kaisahan. Ano man ang dahilan, pag gusto'y may paraan. Ito ang panahon, higit tayong kailangan. ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Gurong Pilipino, mabuhay ka. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay. Sa mundong sabi, sa pagkakapantay-pantay, ilagak ang bukas sa iyong mga kamay. Sa bawat salitang sambit ng iyong bibig, sa mga nangangarap, pag-asa ang hatid. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Mahirap at tila walang katiyakan. Pagkatutoy tubig, hahanap ng daan. Ang liwanag ng mundo'y ating kaisahan. Ano man ang dahilan, pag gusto'y may paraan. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Gurong Pilipino, mabuhay ka. Ano man ang pagsubok, lahat kinakaya. sabi sa pagkakapantay-pantay. Ilagak ang bukas sa iyong mga kamay. Sa bawat salitang sambit ng iyong bibig, sa mga nangangarap, pag-asa ang hatid. Ito ang panahon, higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapisik. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Kahirap at tila walang katiyakan. Pagkatutoy tubig, hahanap ng daan. Ang liwanag ng mundo'y ating kaisahan. Ano man ang dahilan, pag gusto'y may paraan. Ito ang panahon, higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapipising. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Ito ang panahong higit tayong kailangan. Ating lakas, pag-asang hinihintay. Halina't magpatuloy, tayo'y magkapit-bisig. Maraming naghihintay sa ating pagtindig. Ano man ang pagsubok, lahat kinakaya. Gurong Pilipino, mabuhay ka. Mabuhay ka. Gurong Pilipino, mabuhay ka. Ano man ang pagsubok, lahat
Hello, good afternoon. Good afternoon to all our teachers and to our non-teaching personnel in the Division of Santa Rosa City. In a few moments, we will start our webinar. Hello once again to our teachers and non-teaching person, the Division of Santa Rosa City. Welcome to another episode of the Facts Minimize Fears. And this time, we're going to discuss about the COVID-19 Mythbusters. So I think marami po sa atin na nag-iisip, ano kaya itong mga Mythbusters na to? So wag po kayo mag-alala, just sit back and relax and watch and listen to our two resource persons for this afternoon. But before we proceed to our webinar proper, let me just hand you the webinar norms. So first, be fully present. Alam ko po lahat po tayo super busy nowadays at kanina katatapos lang po ng ating training sa ating region when it comes to idea exemplars. So alam ko na nandun pa tayo nakatuon, no? Yung ating mind ay dun pa rin nakafocus sa regional. So for this time naman po, uh, i-leave po natin muna yung mga worries natin, yung mga pag-aalala natin sa mga tasks na gagawin natin because yan po ay magkakaroon po tayo ng date of submission on the task sa ating idea exemplar which will be posted later sa ating Google Classrooms. So that will be later than July, this about this last week of July. So, ipopost po namin yung other details para makakuha po kayo ng certificate naman ng completion. So, for now, makinig po muna tayo kasi maganda pong maunawa natin ano ba yung mga COVID-19 mythbusters. And then, next, participate in the discussions and the activities that will be presented to us or will be introduced to us by our resource persons, if there are. And if you have any questions sa ating webinar, so you can post it sa ating comment section dito po sa live stream. And then later on, during the Q&A portion, ay ating iisa-isahin po ang inyong mga questions and we will answer and we will attend to all your queries later on but through our two resource persons na imbitahan po natin ngayong hapon. Okay. So let's now proceed to the afternoon's opening program. May I invite all of you to please sing with us the Philippine National Anthem and then to be followed by an opening prayer this afternoon and Santa Rosa hymn.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, telas na sinakanan, alam ng puso, sa titik mo'y buhay. Lupang pinirang, tuyag ka ng magiting, sa manlulupi, di ka pasisikin, sa nagatakot Kung sa simoy at sa langit ang pagaw, ay hinatang mula kawin sa pagkayang minamahal. Ang isang ng pagkawat ko'y tagumpay na nag-iindig. Ang bituin at araw niya kailan ang ay magtitindig. Luma ng araw ng walhagit pagsinta, buhay langit sa piling ko. Ang inigaya ng kantay mga akin, ang mamatay ng dahil sa'yo.
Let us put ourselves in the presence of our Lord. O Lord, help me to be fully alive in this moment. Right now, I choose to become everything that you have created me to be. Face to face, I long for you. Deep to deep, I draw close to you. Heart to heart, I touch you. May I feel your perfect love, know your heavenly hope, and receive your gift of faith. May this moment stay with me for the rest of this day. Amen.
Santa Rosa, nagpalang bayan, di paradiso ng kaligayahan, tulad ng diwatang yapan inilan ng patis, ng lakas, at bukal ng buhay. Pag-iwag ka, Santa Rosa, magsaya ka at umamin, masalamat sa biyaya at kalingan itong dahil. Itatangin kay Naghala, kaligaya'y dumawin, manalangin, magingibig, nagpatutang sa pag-ibig. Pag-iwag ka, Santa Rosa, magsaya ka at umamin, masalamat sa biyaya at kalingan itong langit. Itanangin kay Naghala, kaligaya'y dumawin, mamalangin, magingibig, nagpatutang sa pag-ibig.
Our training will not be, or this webinar will not be possible without the help and support from our top management. To give us the opening remarks, may we call on our Assistant Schools Division Superintendent, Sir Ernesto D. Lindo. Hi, Sir Lindo.
Magandang DepEd Santa Rosa sa ating lahat. Welcome sa ating pagpapatuloy ng webinar upang mabawasan ang ating pangamba dulot ng coronavirus. Sadyang nakaka-nervyos at nakakatakot ang samot-saring mga balita na ating naririnig at nakikita sa mga telebisyon at maging sa mga Facebook post sa araw-araw. Nakakatakot din ang patuloy na pagdami ng taong positibo sa COVID-19 sa ating bansa at maging sa buong mundo. Ngayon din sa ating lalawigan at sa ating lungsod ng Santa Rosa at mga lungsod na karatig ng ating lungsod. Ngunit sabi nga sa isang TV program, ligtas ang may alam. Kaya ang pinakamainam at mabisa ay makinig sa mga eksperto upang makaiwas tayo sa coronavirus. Ang webinar na ito ay makakabawas sa ating pag-alaala at makakatulong upang di mapuksa ay tumigil ang virus na ito sa ating mga sarili, galing din sa ating mga pamilya. Dito ay malalaman natin ang mga maling paniniwala at mga tamang kaalaman tungkol sa coronavirus. Wika nga ng mga Tagalog, ang maniwala sa sabi-sabi ay walang bait sa sarili. Kaya tayo na at ating unawaing ang COVID-19 at ang mga kadalasang tanong tungkol dito. Salamat sa ating butihing SDS, kay Ma'am Ella, sa ating SRDT team, pinamula ni Ma'am Elaine, nandiyan din si Ma'am Lea, kay Sir James at Ma'am O ng SGOD at ng CID, at sa ating medical team na pinangunahan ni Ma'am Jennifer at saka si Ma'am Venus. Magandang umaga muli, kahit na hapon na. At mabuhay tayong lahat.
Okay, thank you so much, Sir Lindo, for the opening remarks. Okay po. So, I know marami po pa rin nagtatanong, ano po ba ang Mhpss Hope? Ano po ba ito? Programa, proyekto, or whatsoever? So, to give us a clear explanation about this program, and this program is first na po na-introduce dito po sa atin sa Division of Santa Rosa City. So, without further ado, let us call on our PDO2 of the DRRM section, Ma'am Lea Imelda E. Ibayan. Ma'am Lea.
Okay, yes, good afternoon, everyone. So let me just give you a very short overview of our mental health and psychosocial support program for personnel. Can you see our slides? Okay. We all know that we have been through a lot of stressful situations in the past several months brought about by this pandemic, otherwise known as the COVID-19. And that is a major rationale that we took into consideration in seeing the need to have this program on mental health and psychosocial support for our personnel. So okay, let's just wait for our slide. Mhpss stands for Mental Health and Psychosocial Support Program for Personnel. So our program is called Help Provision for Online Psychosocial Support Services for Employees, or HOPE. Basically, HOPE is a program designed to provide mental health and psychosocial support services to DepEd personnel within the Schools Division of Santa Rosa City that can be offered remotely. It is proposed under the STO Santa Rosa City's DRRM in Basic Education Program and Employees Welfare Program, guided by DepEd's three major outcomes: access, quality, and governance. It is also integrated in the overall health programs of the Department of Education. Okay, next slide, please. Okay, so what are the activities that we have already conducted before and during the actual implementation of the program? So as early as 27 April 2020, we had the program planning conference. May 5, finalization of the program plan. May 20, approval of the program design. June 1, implementation of the MHPSS HOPE. June 2, Hope is Here FB page, our social media campaign. We've also started the local mental health helpline services as of June 2. Okay, from June 5, on June 5 and 10, we had our remote psychological first aid webinar for trainers. July 18 to July 7, we have conducted remote psychological first aid provision to our personnel. And July 17, we've started the Facts Minimize Fears webinar series episode 1. That was the one that we have conducted last week, a very successful webinar on promoting psychological resilience in the workplace during the new normal. So these activities are accompanied by Division Memorandum numbers 193, 209, 243, 263, 265, and 313, series of 2020. We've also established our MHPSS core team. So this is a team composed of selected division and school personnel with relevant MHPSS or related trainings, with background in behavioral science, disaster management, human resources or health education, or are practitioners of mental health and related work who will collaborate on, plan, and lead the implementation of the division MHPSS programs. Okay, next. Okay. We had a lot of limitations due to the pandemic. That is why some of the psychosocial support services that we want to provide, we cannot do it face to face. So that is why we have conducted a remote psychological first aid to our personnel. First, we had a remote PFA training and provision to DRRM coordinators, registered guidance counselors, guidance coordinators, health coordinators, SPED teachers, and schools division office personnel. We also conducted psychological first aid provision. Ito po yung actual provision wherein we had different sessions on validating and normalizing feelings, calming down and controlling one's emotions, linking, identifying, and addressing needs, and sources of strength, which are the four a series of helping actions in psychological first aid. We've conducted this PFA provision to 1,606 teachers and 169 non-teaching personnel. So that is a total of 90% of the total teaching and non-teaching personnel in the schools division of Santa Rosa City that were given PFA remotely from June 5 to July 7. We also had our social media campaign. So meron po tayong Facebook page on Hope is Here. Hope is Here ang pangalan po. So you can like us on Facebook, wherein we want to raise the level of mental health awareness and of course promote psychological resilience in the workplace. Okay, we post mental health trivia, quotes, meron tayong wellness board, and in a month, we already had more than 500 followers. Also, we have established our local mental health and crisis helpline. So dito, nagbibigay tayo ng psychological first aid, may service din tayo ng counseling service at referral system. Referral system, kapag hindi na po natin kayang i-provide ang care sa mga lumalapit sa atin at nakikita natin yung need ng specialized services at ito ay pwedeng ibigay lamang ng mga mental health experts. That is why we have also established a referral system sa ating schools division office. And ito na po yung ating mga ongoing and upcoming activities. Ito nga pong Facts Minimize Fears webinar series na ginagawa natin ngayon. Episode 2 na po yung ngayon. And then this will be followed by wellness and neurological healthcare in partnership with Lingap Diwa Unilab. And also our art-based psychosocial interventions guide to teachers. Okay, so these are just some of the activities on mental health and psychosocial support, which is in response to our uh, pandemic, the COVID-19 pandemic, in order to ready our teachers and all our personnel in the opening of classes. And this is also part of our learning continuity plan. That's it. Thank you.
Yes, thank you so much, Ma'am Leah, for enlightening us about the MHPSS Hope. So, malinaw na po sa atin ngayon na ito po ay isang division initiative para po sa welfare po ng ating mga employees. And soon, magkakaroon po naman tayo para din sa mga learners. Okay, so let's now proceed to the webinar proper. I know you are excited na. Tama ba? Excited na ba kayo? Ayan, nakikita natin sa comment section, no? From, I think from Central 1, Central 3, yes, Labas Elementary School ng mga participants, Southville 4 National High School, Balibado Integrated High School, sa Santa Rosa Science and Technology High School, Aplaya National High School Annex. Okay, so good afternoon po sa ating lahat. So hindi na natin pahintayin pa, no? I-proceed na po natin sa ating topic, no, about the COVID Mythbusters. So to discuss about this, may we call on our two representatives ng ating school health section. Okay, so we have Dr. Jennifer Amor Ramilo, our new medical officer, and our very own Nurse Venus Manalo, to Nurse 2, okay, of Santa Rosa City. So to discuss deeds and facts about the COVID-19. Hello, Ma'am Venus and Dr. Jen. Hello po.
Ma'am Elaine, good afternoon.
Hi ma'am, good afternoon po.
Ayan. So, good afternoon. Okay. So, let's now proceed.
Yes. Let's just wait for the presentation to open.
Okay, good afternoon po sa lahat. Pasensya na po, we're currently experiencing some technical problems. Antayin lang po nating makabalik si Dr. Jen. I hope na you're feeling okay right now while doing this seminar po.
So there, sorry for the delay. Just having some technical difficulties. Let's start na po. Okay. So good day to everyone. Like what Sir Dindo said in his opening remarks, we can minimize our fears by being equipped with the right knowledge and information. So with that, hopefully at the end of our session, we'll be able to attain the following objectives. For my disclaimer, I am not an infectious disease specialist, and our presentation may not include all relevant facts or the most up-to-date researches. Next slide. So let's review first some basic information on COVID-19. COVID-19 is caused by a virus known as the severe acute respiratory syndrome coronavirus 2. The incubation period, meaning it's a time from the exposure to the virus until the appearance of the first symptoms, is 1 to 14 days. Based on studies, average incubation period is 5 to 6 days. People at risk for having severe disease are those who are those who belong to the older population, and the people with comorbidities such as diabetes, heart or lung disease. For the treatment, there is still no approved treatment for COVID. Hence, the management is directed to the symptoms. This virus is an enveloped virus with a fragile outer membrane. Generally, enveloped viruses are less stable in the environment and are more susceptible to oxidants such as chlorine. Next. So it is important to note that a new coronavirus can live on surfaces from 3 hours to 7 days. Next slide, please. There are no specific clinical features that could confirm you to having COVID-19 unless you are subjected for laboratory testing. So far, the most common symptoms of COVID-19 are fever, dry cough, and tiredness. Some patients may have aches and pains, nasal congestion, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people, other signs and symptoms reported are loss of taste and smell. Some people become infected but only have very mild symptoms. Karamihan kasi na nagkakasakit, about 80%, recover from the disease without needing hospital treatment. Next slide. So with regards to the transmission of the disease, the virus could spread mainly from person to person who are first in enclosed spaces with insufficient ventilations, crowded conditions with people, and conversing with other people in short distances or within 1 to 2 meters. Next slide. The first transmission pathway is through droplet infection, where the virus spreads through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land into the oral and nasal surfaces of people nearby and could possibly be inhaled into the lungs. As we saw earlier, the virus is known to survive for some time on surfaces such as tablets, doorknobs, and handrails. So, the second transmission pathway is contact infection. This happens when a person touches the surface with respiratory droplets, then another person touches that surface and then touches his mouth, eyes, or nose. Next slide. So, how do we prevent ourselves from acquiring the disease? The measures undertaken for infection prevention control are not only meant to protect yourself, but also to protect your family and the bigger community you live in. Next. So multiple studies shows that mask reduces transmission by 85%. Physical distancing of at least 3 feet reduces transmission by 80%. and the use of face shield or eye protection decreases transmission by 78%. Regular and thorough hand washing with soap and water for at least 20 seconds is the most effective preventive measure. If soap and water are not readily available, use of alcohol-based hand rub of at least 60 to 70% alcohol for at least 20 seconds should suffice. Next slide. Another way of preventing the transmission of the disease is by practicing respiratory hygiene. Ano po ba yung respiratory hygiene or etiquette na sinasabi? Ito po yung pagtakip ng ilong at bibig when coughing or sneezing with the use of our elbow or tissue. And then, yung tissue na nagamit natin should be disposed properly in a trash can. Tapos, after disposing it properly, kailangan po natin hugasan yung kamay with soap and water, or if it's not available, alcohol po is used to kill any virus remaining in our hands. We also should wear mask if we have respiratory symptoms and should perform hand hygiene after removing the mask. We should also remember to avoid touching the eyes, nose, and the mouth. So, for updates on DepEd Order Number 14 on the guidelines on required health standards in basic education offices and school, Ma'am Venus Manalo, our nurse, will walk us through the said order. Ma'am Venus.
Okay, Doc Jen. So for this afternoon, I will be discussing about DepEd Order Number 14, Series of 2020, also known as the Guidelines on the Required Health Standards in Basic Education Offices and Schools. So these guidelines were created or were issued by the Department of Education to ensure the safe return to schools and offices and to guide the learners, teaching and non-teaching personnel. These guidelines are based on the guidelines on the risk-based public health standards for COVID-19 mitigation cited by the IATF. So DepEd Order Number 14 has 4 mitigation objectives, namely increase physical and mental resilience, reduce transmission, reduce contact, and reduce duration of infection. So let's go about the 4 objectives. Next slide, please. So the first objective is about increasing physical and mental resilience. So what are the strategies to increase physical and mental resilience? First, for the physical aspect in schools, it involves the re-establishment of regular and safe delivery of essential school-based services. Also, the reinstitution of the school-based feeding program, promotion of school life balance, and encouraging our learners to perform daily physical activities while observing physical distancing. For DepEd offices, all personnel are encouraged to engage in 30 minutes daily physical activity while strictly adhering to physical distancing, proper hygiene, and other safety and precautionary measures. Smoking and drinking are also discouraged. For the mental aspect, in the schools, once po na nag-open na ulit tayo for the face-to-face modality, discussions of the modules related to mental health during the first week of classes, and operationalization of guidance offices in schools. DepEd offices, strategies include provision of mental health and psychosocial support, debriefing sessions, and promotion of work-life balance through proper scheduling and rotation of workforce. For schools and other personnel din po, the department will ensure appropriate support for the essential workforce vulnerable groups, and most at-risk population, learners, and personnel. Next slide po. Next po. Sige po. Okay, the second objective is reducing transmission. So how do we reduce transmission? Through sustaining proper information and education campaigns on proper hand washing, ensuring that symptomatic individuals would stay at home and seek medical consultation, routine cleaning and disinfection of workstations and touch areas such as toilets, doorknobs, and switches at least once every day, ensuring access to basic hygiene facilities, the rational use of personal protective equipment such as masks, and when time comes that face-to-face modality will be allowed, the school should follow the standard set in DepEd Order Number 10 Series of 2016, which is the policy and guidelines on the comprehensive water, sanitation, and hygiene in schools program. And they will also be required to conduct orientation on proper respiratory etiquette for learners, teachers, and personnel. Next slide, please. So now, kanina po diniscuss si Doktora yung sa cough etiquette and where to throw po pag ginamit nating tissue. Now we would be practicing po the proper hand washing technique. So this infographic was given to us by the World Health Organization. So samahan niyo po ako, sabayan niyo ako sa pagpa-practice po ng ating hand washing technique. So magsimula po tayo, it's step 0 to 11. So for step 0, we wet hands with water. Now, first step is to apply enough soap to cover all hand surfaces. Second is we rub hands palm to palm. So, palm to palm. The third step is the right palm over the left dorsum. This is the dorsum. With interlaced fingers. Ganyan po siya. And then vice versa, yung kabaliktaran naman. Yan. And then the fifth step is back of fingers to opposing palms with fingers interlocked. So, ayan po siya. Magka-lock silang dalawa. Kabila din po. The sixth step is the rotational rubbing of the left thumb clasped in right palm. So, ganun po. Ganyan. Tapos, yung kabila naman. And the seventh step is the rotational rubbing backwards and forwards with clasped fingers of right hand in left palm. So, paganto po siya. Ayan. Yan, tas ganyan. And then, you rinse our hands. We make sure that we use a dry towel. A single-use towel pa nga ang recommended. Pero, syempre, hirap naman kung disposable yung towel. So, you could use clean towels. Yung ginamit na rin nating towel sa step 10 ang gagamitin natin to turn off the faucet. Kasi, malinis na po yung ating mga kamay. Okay, next slide, please. So for the third objective, that is to reduce contact. So the strategies involved are the implementation of strict physical distancing in all common areas. So at least 1 meter, pero mas malayo, mas maganda. All travel and activities of learners and personnel shall be restricted to the most essential. Restriction of large gatherings and other activities where physical distancing is not possible, and the utilization of alternative work arrangements to minimize contact in schools, in CLCs, and DepEd offices. Next slide, please. Now we go to the fourth objective, which is to reduce the duration of infection. So in reducing the duration of infection, early detection and isolation of symptomatic individuals must be ensured. So, paano po ba natin siya gagawin? So, we have a program in the Department of Education which we call the Preventive Alert Systems in Schools or the PAS. Nire-echo po namin ito. Ang title lang niya would be PAS on, Preventive Alert Systems in Schools Operationalized Now. So, ang objective lang po nito is to identify possible cases by daily health inspection of our learners. And then the second strategy is to establish, set up, or refurbish school clinics, clinics in schools, CLCs, and DepEd offices for health assessment, provision of first aid or treatment, proper management of symptoms, provision of referral services, and follow-up. By the way po, we would like to inform everybody that the school health section clinic in the division office has resumed po its functions last June 2020 pa. So if you have any transactions with us po, we're open naman kasi we're on alternative work arrangement din po. Next slide, please. So part din po ng inclusion ng DepEd Order number 14 ay yung testing protocol. So it's an integral part of the interrelated health standards and measures. Testing will be employed as a diagnostic tool for detection and contact tracing for us to suppress or to prevent the spread of COVID-19 to the DepEd family and the immediate community. And please do take note, where feasible and available, it can be used as clearance of a suspected individual to return to work or school. However, the DepEd Order number 14 also emphasized that testing, the COVID-19 testing of returning personnel and learners shall not be a condition for the return to offices and schools. So tandaan po natin, hindi siya kondisyon. Meron pong ibang hihingiing requirement ang Department of Education bago ka makabalik sa trabaho if you are COVID-19 positive po or if you are symptomatic. Next slide, please. So this DepEd testing protocol is based on the DOH Department Memorandum number 2020-0180. That's the revised interim guidelines on expanded testing, and the Department Memorandum number 2020-0220, or the interim guidelines on return to work. So doon po ina-identify sino yung individuals at define yung expanded testing. So sabi doon, it's testing of all individuals at risk of contracting COVID-19 infection. So sino-sino po ba yung mga at-risk na individual? So una yung mga suspected cases natin. Pangalawa, the individuals with relevant history of travel and exposure, whether symptomatic or asymptomatic. And third are the healthcare workers with possible exposure, whether symptomatic or asymptomatic. Next slide po. Sabi din po sa testing protocol, indiscriminate testing beyond close contact of a confirmed COVID-19 positive case is not recommended by the DOH. So ang recommendation po is more on the close contact of a confirmed COVID-19 positive case. Next slide po. The testing protocol also identified different subgroups who has the greatest to the lowest need for testing. So we have 4 subgroups. So subgroup A are patients or healthcare workers with severe or critical symptoms with relevant history of either travel or contact. Subgroup B are patients or healthcare workers with mild symptoms with either relevant history of travel or contact and considered vulnerable. Subgroup C are patients or healthcare workers with mild symptoms with either relevant history of travel or contact. And subgroup D are patients or healthcare workers with no symptoms but with either relevant history of travel or contact. Next slide, please. So we have 2 tests available for COVID-19. So the first one is the RT-PCR. Ang long name niya is the real-time polymerase chain reaction test. This is the confirmatory test for COVID-19. However, ang rapid antibody-based test kits po ay maaari din gamitin basta it's approved by the FDA under certain conditions provided in the revised interim guidelines on expanded testing of the Department of Health. Next slide. So kanina pa po natin naririnig yung term na close contact. Paano nga ba natin masasabi na ang isang tao or tayo particularly ay isang close contact? So the CDC of the United States of America defined close contact as any individual within 6 feet of an infected person for at least 15 minutes of laboratory confirmed or probable COVID-19 patients. Yan. So kapag daw po tayo ay within 6 feet at nakasama natin ng at least 15 minutes ang isang confirmed or probable COVID-19 patient, may tuturing po tayong close contact. Next po. So on your screens right now are some of the frequently asked questions regarding rapid diagnostic tests. This infographic is from the Department of Health. So ang unang tanong po, ano ang dalawang uri ng test na ginagamit sa COVID-19? So ang sagot po, method A, method 1, the RT-PCR. Ito po, tumutukoy kung may virus ang tao bago pa man magpakita ng sintomas. So ito po ang pinakatiyak na test. Ang ikalawa po ay ang paggamit ng rapid antibody-based method. Ito naman po, tumutukoy sa presence ng antibody sa katawan ng tao pagkatapos magpakita ng sintomas at limitado ang katiyakan ng resulta. So ulitin ko po, ang rapid antibody testing po ay hindi ginagamit sa pag-confirm ng COVID-19. Next slide po. Okay, ang pangalawang tanong po, ano ang mas mapagkakatiwalaan sa pag-confirm ng COVID-19? RT-PCR po ba or the rapid antibody test-based test? So yun naman po, ang sagot ay di hamak naman na mas mapagkakatiwalaan ang RT-PCR testing kasi virus po ang kaniyang tinutukoy. Samantalang yung rapid antibody-based test results po ay lalabas lang siya, mas magiging effective po siya kung ang isang tao po ay na-infect na. So kung halimbawa ang viral load po or ang dami ng virus sa katawan ay hindi pa ganun kasapat para mag-produce ng sintomas, maaari po itong mag-create ng false positive o false negative na resulta. Next slide please. Ang ikatlong tanong, sino-sino po ang maaaring itest gamit ang rapid antibody-based test kits? So ang pwede lang pong itest gamit ang rapid antibody test kits ay yung mga tao na nagpakita na po ng sintomas pagkatapos ng 5 hanggang 21 araw. So hindi po siya nire-recommenda na gamitin para sa mga taong walang symptoms kasi hindi nga po siya magbibigay ng accurate na result. Ang pang-apat na tanong, ano ang kahalagahan ng rapid antibody-based test kits? Maaari po itong gamiting katuwang para matukoy po kung talagang negative na ang isang pasyente na wala ng symptoms, na nakatapos na po ng kanyang quarantine at na-discharge na sa ospital. Next slide po. So ano-ano po ang susunod na, say for instance, kayo po ay nagpa-rapid antibody-based test, tapos bawa nag-positive kayo, ano bang dapat nating gawin? Ang una po, kung kayo ay nag-positive, kinakailangan nyo mag-isolate. At kinakailangan po, makuhanan pa rin kayo ng samples para sa RT-PCR test. Kasi hindi po natin mako-confirm kung kayo ay COVID-19 positive not unless mag-undergo po tayo ng RT-PCR testing. Ang pangalawang tanong, halimbawa, may symptoms pero nag-negative sa rapid antibody-based test. Anong gagawin? Kung meron pong sintomas, ganun din po, kailangan ma-isolate, kailangan makuhanan pa rin po ng samples. Kasi nga, ang confirmatory testing po ay yung RT-PCR pa rin. So, hindi po natin pwedeng sabihin na, nag-negative ka, may symptoms ka, pero nag-negative ka sa rapid antibody-based test, ay negative ka na talaga. Kasi kailangan sa RT-PCR testing, doon ka mag-negative. Next slide po. So, kasama din po sa inclusions ng DepEd Order No. 14 ang pagsiscreen po ng mga returning personnel. So, lahat po ng babalik sa trabaho ay kailangan pong ma-screen for symptoms of COVID-19 like fever, cough, colds, and other respiratory symptoms and their relevant history of travel or exposure within the last 40 days. So, granted po, kayo ay returning personnel, symptomatic, may relevant history ng travel or exposure on the date na babalik kayo sa trabaho, kayo po ay hindi papayagang mag-report and you must first consult with your primary care provider. Next slide po. Ang sunod po, returning personnel who were symptomatic na may relevant history of travel or exposed sa isang COVID-19 positive case within the last 14 days bago pa man siya bumalik sa trabaho, kailangan po munang magpresenta ng Certificate of Quarantine Completion na pwede po niyang kuhanin sa isang step-down facility or sa local health office kung ano man po ang applicable sa pinaka-latest na guidelines ng Department of Health. Kapag naman po kayo ay asymptomatic within the last 14 days bago po tayo bumalik sa trabaho at wala po kayong relevant history of travel or exposure, kayo po ay papayagan ng bumalik sa trabaho. Next slide po. So kapag kayo po ay asymptomatic within the last 14 days prior to your return to work, pero kayo po ay may history ng travel or exposure, maaari lang po kayong bumalik sa trabaho kung kayo po ay magpe-present ng medical certificate. So yung MedCert po ay maaaring manggaling sa DepEd School Health Personnel or sa inyong provincial, municipal, or city health office. If kayo naman po ay symptomatic within the last 14 days prior to the date of work resumption, pero wala kayong history of travel or exposure, kinakailangan pa rin po ninyong humingi ng medical advice at kailangan ma-issuehan pa rin po ng MedCert bago kayo bumalik sa trabaho. So, ang klaro po doon, basta kayo ay symptomatic, whether may travel history or exposure history or wala man, kailangan po magpresenta muna kayo ng MedCert para sigurado po na wala po kayong COVID-19. Next slide po. So kasama din po sa DepEd Order Number 14 yung mga support protocol. So ito pong dalawa ay sa testing po ito. So DepEd shall coordinate with PhilHealth on the coverage of applicable packages to learners, teachers, and personnel and work out a possible institutional arrangement with the agency. And DepEd shall set aside an amount to subsidize indicated testing for learners, teachers, and personnel subject to availability of funds and applicable budget and accounting requirements. Next slide po. So kung kayo po ay na-expose sa isang confirmed case, ano nga ba ang dapat natin gawin? Tinatawagan ko po muli si Dr. Jen Ramilo para po ipaliwanag po itong dapat natin gawin pag tayo po ay na-expose sa isang confirmed case.
Yes, so what if na-expose nga po tayo sa isang nag-positive for COVID-19? Kailangan ba natin mag-test kagad? And ano po ba dapat natin gawin? For personalized care, pwede naman po tayong tumawag sa DOH hotline 1555. Pero yung nakikita niyo po sa screen ngayon is siya yung old classification ng ng mga persons with exposure or confirmed case. Yung protocol is still the same. And ito yung mga general principles. If symptomatic ka, ibig sabihin may fever, cough, colds, or masakit na lalamunan, you probably need the RT-PCR test, yung confirmatory test natin. Kailangan parati ka naka-face mask and isolate yourself as much as possible. If mag-develop ka ng symptoms such as nahihirapan kang huminga, you must proceed to the nearest emergency room. But if you have mild symptoms, then you may be instructed to isolate at home after the test has been done. If you do not have an adequate setup para ma-isolate sa bahay, you can contact the LGU or the community health office, city health office para matanong natin if tungkol sa mga isolation facilities ng area natin. So, what if wala ka namang symptoms pero exposed ka? Then, you may or may not need test depending sa exposure mo. And paano yung exposure mo? If more than last exposure sa isang confirmed case and never ka naman ng symptoms, then hindi mo na kailangan ma-test or ma-isolate for that particular contact. But if less than 14 days since yung exposure, kailangan natin consider yung degree ng exposure mo. Close contact ka ba? Meaning, may direct physical contact ka, or more than 15 minutes yung contact mo, and at least less than 3 feet yung distance nyo. Or nag-provide ka ba ng care sa isang confirmed patient nang wala kang suot na adequate PPE? If yes, then kailangan mong i-quarantine yung sarili mo immediately, and you may be tested, but it should be done at least 5 days from the last contact, since pag maaga natin ginawa yung test, pwede mag-false negative yung result. If it has been more than 5 days since yung contact, then you can opt to have yourself tested, or pwede ka namang continue ng quarantine sa bahay to complete the 14 days even without a test. But if magkaroon ka ng symptoms during that 14-day observation period or quarantine period, then kailangan mo magpa-consult with a doctor and you may be tested. So, what if you were exposed naman to someone na na-expose sa isang positive case na hindi pa natetest? So, parang ang nangyari, parang second generation contact ka. You will not need to isolate or test unless you develop symptoms. Or yung person na na-expose ka, na na-expose dun sa nag-positive, ay nagpa-test at nag-positive siya. You should continue to observe yung pag-mask and observe din yung physical distancing while waiting for your contact's result. If your contact mo is negative, then and he or she remains asymptomatic, then you don't need testing unless you develop your symptoms or na-expose ka na naman sa isang nag-positive na person. So, next slide. For the updates on COVID-19, next slide. There are lots of discussion on airborne transmission of COVID-19. First, ano po bang airborne transmission? Airborne transmission is defined as the spread of infectious agent by the dissemination of droplet nuclei or aerosols that remain infectious when suspended in air over long distance and time. So, the SARS-CoV-2, yung virus, can be airborne in some specific situations. Is yung hospital setting, where yung mga healthcare workers do aerosol-generating procedures such as pagsusuction ng secretions, pag-i-intubate o pagtutubo ng pasyente, or procedures that involve the upper airway tract. So during these times, the best protection is the use of the appropriate PPE, including the use of N95 mask. So, ano po ba ibig sabihin if ang COVID-19 is airborne? It means that the COVID
Okay po, thank you, Doc Jen. So, next slide po. Okay. So, for the mutation, so meron pong story regarding the D614G na Ang sabi po doon ay the mutation of the SARS-CoV-2 or the causative agent of COVID-19 on the spike protein that enables it to infect the cells. So there were 2 pieces of evidence published in different journals that was reviewed and regarded as one of the best journals in science. Una muna po ay napaltan yung D614 ng G614. Doon po sa, this is in Europe. And then the other one for a short period of time. Okay, so para po mag-explain pa further regarding mutation, I think Doc Jen is back na. Doc?
Yes, sorry for some technical difficulties. Nandito po
Yes
ako
po.
sa Batangas. And medyo mahirap ang signal. So, nasa na ba tayo? For mutation, so based sa studies, yung mutation sa SARS-CoV virus is dun sa, is what we call the D614G mutation. Yun yung mutation sa spike protein ng virus that enables it to infect cells. According to studies, there does not seem to have any data that it leads to more severe disease, but it is definitely easier to spread. Meaning, yung studies, nagli-link siya na hindi naman nagkakos ng more severe disease yung virus. However, mas mabilis siyang kumalat. So therefore, kailangan lang po natin, we need to wear our mask meticulously and practice physical distancing at all times. So that's it for the updates. Ma'am Venus, are there anything more you want to add?
Okay, thanks, Doc. Okay, so before po we end this presentation, next slide po, we will be leaving you with a quote from Nelson Mandela, and I hope it would serve as a reminder for all of us. He said, "An educated, enlightened, and informed population is one of the surest ways of promoting the health of a democracy." So translating it in our current situation, we all need to be informed, we need to be educated, we need to keep ourselves updated with the trends and with the different studies. Kasi ito po yung magiging panlaban natin to keep ourselves and our family and the people around us healthy and safe all the time. So with that, we are ending our presentation. We would like to say thank you for sharing your time with us. So on behalf of my co-presenter, our new medical officer, Dr. Jennifer Amoramilo, I'm Venus Manalo. So maraming salamat po. Have a great weekend and stay safe, everyone.
Ayan. So, thank you so much, Dr. Jen and Nurse Benu. So, stay lang po tayo dito, Nurse Venus and Doc Jen, kasi we will proceed now to the Q&A portion of our webinar. Ayan. So, let us check first yung mga comments natin. Ayan. Sa ating chat box. So while checking the comments, I would also like to acknowledge the presence of Ma'am Leia Ibayan. Nandito rin po siya. Ma'am Leia.
Yes, nandito ako.
Ayan. Okay. So kung may questions po kayo, you may post sa ating chat para po sa Q&A, and I will read isa and para masagot po ng ating mga taga school health section po. Ako nakita isa dito kanina. Ayan, wait. So, alam naman po natin sa ngayon na marami po pa rin na cases din sa community natin, lalo na sa Santa Rosa. So, I think very timely rin to discuss with you this COVID-19 issues or facts para ma-update din tayo as well. So, meron dito pong question. I'll post it. Medyo wait lang po ha. Nag-post. So, see, yan. So, from Ma'am, I think it's Ma'am Beth Barata. Okay. Meron po dito isa. Sana po gawing mandatory ang rapid testing sa mga public schools. From K. Dala. Thank you. Okay. So, I think meron din kaninang question din po regarding dun sa kung lahat ba ng public schools natin ngayon na public school. I think that's for Doc Jen.
Yes, ma'am.
Yes, Doc Jen. So may question dito na kung isususugan ko lang yung question kanina, no, yung comment no, kanina regarding the testing. So ang question is, magkakaroon ba tayo sa mga public schools natin teachers ng rapid testing?
So far, kasi di ba na-discuss kanina ni Ma'am Venus, yung testing kasi, indiscriminate testing is not advised. So, yung testing natin is more of para dun sa mga close contact talaga as of now. But if ever magkaroon tayo ng law or memo testing, then
Okay, so yes. So kung meron po tayo, so i-advise naman po sila if there is, no? But for now po, ay so far wala pa po. So another question po, ano po daw ang pagkakaiba ng rapid test at swab test? Okay, that's from Ma'am Beth Bara. I think Nurse Venus can answer that question.
Hi ma'am, hindi ko po masyadong narinig. Ang question po ba is ang difference po between RT-PCR and the rapid antibody-based test? Tama po ba ang nag-grasp ko?
What is the difference between the swab test and the rapid test?
Okay po. So bukod po dun sa kung ano yung ina-identify nila, yung method din po ay yung specimen na ginagamit for RT-PCR and the rapid antibody-based test po ay magkaiba. So for the RT-PCR po, ang ginagamit po dito is the throat and the nasal swab. Yun pong kukuha ng magsaswab po sa loob ng ilong. Yun ang specimen na ginagamit po dito sa RT-PCR. And for the rapid antibody-based test po, kadalasan ang ginagamit dito is blood specimen po siya. So kung nakakita po kayo ngayon, medyo uso naman sa social media yung mga nagpo-post. Ang itsura po ng rapid antibody-based testing ay parang yung pregnancy test kit po. Ganun yung itsura niya. Tapos may nakasulat lang na yung parang yung nilabas nung una kung nakasulat yung mga immunoglobulins. So yun yung mga antibodies, IgM, IgG, tapos negative po. So yun po yung difference nila. Tapos bukod po doon, yun nga, ang RT-PCR ay ang confirmatory testing for COVID-19, while the rapid antibody-based test po ay parang mas recommended siya for people na nagpakita na po ng symptoms. Kasi yung antibodies, lalabas lang siya kapag po may symptoms na yung tao. Hindi po siya lalabas, walang ilalabanan yung katawan kung wala pong pumasok na virus or kahit ano po sa katawan niya. At hindi rin po siya ginagamit as confirmatory for COVID-19. So yun po.
Okay, so yun po malinaw po yun, no? Magkaiba po siya ng paggagamitan. Talagang may symptoms na siya. So, ibig sabihin, lumabas na yung meron ng nakikita sa katawan. So, dun pa lang tayo pwede dun sa isang test na tinutukoy po ni Nurse Nose. Okay. So, another, okay, if in case po, magkakaroon ng rapid testing sa ating division, sino daw po ang pwedeng mag-shoulder ng expenses? Ayan. So, medyo maganda rin question yan, no? In case nga naman na rapid test tayo, so sino daw po ang mag-shoulder ng ating expenses? So, anyone from our resource persons can answer?
Yes, ma'am. If in case magkaroon po tayo ng rapid testing and it is supported by an order or a memo coming from the higher ups, the top management or the central office, then I guess it will be shouldered by the division if magkakaroon po tayo ng budget.
Okay. So, medyo malaki-laki rin po kasi yung magiging expense po natin dyan. So, siguro talagang kailangan paghandaan po ang regarding sa budget ng ating testing, no po, kung magkakaroon man tayo ng testing para dyan. And I think siguro it will be good help po if makakatulong din yung galing sa local government natin. No? Siguro matutulungan naman tayo with regards to that if na kailangan po natin magpa-rapid test or mag-testing sa ating lugar. Okay, so meron po naman ditong mga comment. I think nasagot po natin yung tanong ni Ma'am Mercy Maputo. Pero dito may mga pa-shoutout po sa atin ng mga teachers po from wala po from Balibago, I think, Balibago High School, from Sir Ferdinand Daril. Yan, okay. Another thing, sige po. Mga questions pa po kayo, PM nyo lang po dito or i-post nyo lang po yung comment sa ating chat box para po makita natin. Ayan, so may question po dito from Ma'am Nemer Israel din. Meron daw po ba itong vaccine na ba ang ating para sa COVID-19? Meron na po ba talaga daw available?
Yes, ma'am. With regards sa vaccine, so far, under clinical trial pa lang siya. Yung parang nasa phase 3 pa lang siya ng clinical trial, meaning na alam pa yung effectivity nung vaccine. So far, sa ngayon, wala pa po talagang vaccine for COVID-19. Though, meron po tayong flu vaccine and the pneumococcal vaccine which can prevent us sa complications possible complications ng respiratory diseases.
Okay. Thank you so much, Doc. Another question daw po. According to Ma'am Christina Manehable. Okay, sana tama yung pronunciation, no? Pwede po bang i-elaborate daw po uli yung tungkol sa airborne transmission? Okay? Kasi medyo nawala po kanina, no? Pasensya na rin po because of the internet connectivity. So, kaya nagkakaroon tayo ng problem din on the live streaming. So, again po, from Ma'am Christina Manehable, pwede po ba paki-elaborate po yung airborne transmission? Yes, Doktora? Dr. Jen? Ayan, medyo mahina yung internet ni Doktora. Nurse Venus, pwedeng kaya paki-elaborate daw po ang ating topic on the airborne transmission.
Okay po, hello po. Okay, so sa airborne transmission po, yung causative agent, yung SARS-CoV-2 po, ay pwede siyang matransmit via airborne. Usually po, ang common situations ay kapag sa hospital. Kasi pag nag-aerosolize po kasi siya. May mga procedures po kasi na nagkakaroon ng aerosolization. So, ito po yung mga procedures sa hospitals like suctioning, intubation, or lahat po ng procedures na nag-i-involve ng upper airway. Kaya po, ang mga health workers po ay talagang ina-advise to wear appropriate PPE, lalo na po yung N95 mask kasi para po walang makapasok na po sila. Tapos, based on studies po, may mga discussions pa din kung hindi pa siya malinaw kung ang pagiging airborne, pagta-transmit via the airborne mechanism ng SARS-CoV-2 ay nangyayari outside hospital. Pero meron mga mas maliit na particles na pwede pong mag-travel at a greater distance. So, yung pwede pong madala ng hangin. So, pwede nga siyang umikot. Pero, hindi naman po ibig sabihin na yung if they are airborne, hindi na sabihin na they necessarily contain enough virus to infect someone. So yun po, kaya yung pong aspect ng airborne transmission is under research pa, lalo na po outside of the hospital setting po. So yun po. So kaya ang for droplet nuclei, we still have to follow po the precautionary and the safety protocols po. So, kailangan pa rin magsuot po tayo ng mask. Kailangan, if possible po, we maintain the strict physical distancing, and then we minimize po, we avoid places na may mga we avoid crowded areas po. And then, as much as possible, sa mga enclosed spaces po, minsan, di ba, kapag tayo po ay mga nasa opisina, minsan, hindi natin maiwasan na tanggalin yung ating mga mask. So, it's still implicated po na we still wear our mask to prevent po from contracting the disease. So, yun po.
Okay, so in short, no, always wear mask, no, kasi hindi na natin alam yung transmission ngayon. It can also be airborne, no? Pwedeng sa air na nakukuha ang COVID. Another question here is, magkakaroon daw po ba ng annual medical examination para sa mga guro bago bumalik sa work? So kasi we are used na meron po tayong annual physical check-up, no, every year. Yes, tama, no. Meron din na free check-up in the past years din po natin. So this year po ba, bago daw po bumalik work, ang mga guro natin ay meron ba tayong annual examination?
Yes. Can you hear me?
Yes, Doc. Go ahead po.
Yes. With regards dun sa annual medical examination ng teachers,
Go ahead,
included
Doc.
po na yan sa DO number.
Hello, Dr. Jen. Okay, medyo mahina uli ang internet ni Dr. I think Nurse Venus can elaborate about this matter. Nurse Venus. So magkakaroon tayo ng annual medical check-up ngayong taon, mga kaguruan po natin, no, sa ating trabaho. Nurse Venus. Ayan, ako, medyo nawala nilang dalawa. So while waiting for them, nagkakaroon tayo ng difficulty, no? Kasi live po tayo ngayon at kami ay nasa kanya-kanya mga bahay din ngayong Friday. So kami po ay working at home lahat. So ayan, sige.
Yes,
Doc Jen,
I'm back.
are you ready na po to answer? Yan, you're
Sa,
back,
ano,
Doc Jen.
sa
Sige po.
probinsya.
So meron daw po
And-
tayong annual medical check-up. Meron po ba tayong medical check-up ngayong taon, Doc?
Based sa DO number 14, meron tayong annual medical examination. However, yung bago bumalik sa work, medyo doon tayo maano. Kasi so far, undergoing pa yung, based sa sinabi sa akin ni Sir Ken, undergoing pa yung parang bidding for the funds para din dun sa ano natin, sa magpo-provide ng laboratories natin.
Okay, so wait na lang po siguro for memorandum for that concern po, no, with regards to Sir Julius Mengulio. Am I correct daw po ba with his understanding that only DepEd personnel who are exposed to COVID-19 positive patients or even in close contact with them subject for COVID-19 testing, be it symptomatic or asymptomatic? Ayan. So, naka-flash po yan sa ating screen ngayon. So, am I correct daw po sa kanyang understanding with regards to the DepEd personnel na daw po sa COVID-19 patients, are they subject for COVID-19 testing as to be asymptomatic or symptomatic? Okay, anyone from our two resource persons today?
Yes. Ma'am.
Go ahead, Doc. Hello, Doc. Ayan, medyo nawala ulit.
Yes,
There's Venus.
ma'am.
Can you say something
Okay.
about this?
The question is yung
Ayan,
tungkol
ayan.
sa
Sige, go ahead, you're back. Kung na-expose daw po, no, yung mga DepEd personnel natin sa COVID-19 positive patients or even have a close contact with them, are they subject for COVID-19 testing, whether symptomatic or asymptomatic? Tama po ba?
okay.
Tama daw po ba ang understanding niya?
Okay. If symptomatic, may close contact po kayo, meaning yun nga po, tapos, with symptoms, ibig sabihin, may cough, colds, fever, kailangan, yes? Opo. Most likely, you will be subjected sa COVID-19, the RT-PCR test. But if wala po kayong symptoms, you may or may not be subjected po dun sa test. Depende po sa exposure nyo at saka kung exposure. If more than 14 days na po since the exposure, you don't need to have the test. But if yun nga po, less than 14 days, and
Yes, Doktora. Mahina uli internet. So, hintayin natin si Doc na makabalik. I think Nurse Venus can elaborate this matter. Nurse Venus?
Okay po. So, ang question po ni ma'am is, am I correct with my understanding that only we're exposed to co or... okay. So, kung maaalala niyo po kanina, pinresent ko yung dun sa testing protocol po based dun sa guidelines ng DOH, yung 4 na subgroups. And siya po ay, yung subgroup A, B, C, and D po ay, ano siya, parang may hierarchy po. Ito yung may lowest need for testing. And subgroup D, the category falls po for patients or healthcare workers with no symptoms but with either relevant history of travel or contact. So if asymptomatic po, it would fall on subgroup D. Pero kung kayo po ay symptomatic naman, depende po sa klase ng symptom, if it's severe, you have the greatest need to be tested. And if it is mild, ang symptoms po, whether meron or walang history, nasa subgroup B and C po siya. So, ang ano po ang close contact. So, ang gagawin po, halimbawa kayo ay na-expose and you are asymptomatic, you are first advised po to do quarantine for 14 days. So, kung wala pong symptoms, you observe yourself. Kung wala po, kung wala naman, and then parang hindi naman siya subject for testing. More on if you develop within the 14-day quarantine period, since you have a history, you are subject po for testing na kaagad. Para po yun, para malaman na rin po. So yun po, it would fall on subgroup D, and according to the guidelines of the DOH, yung asymptomatic po has the lowest need to be tested. Whether you have history of travel or contact po with a COVID-19 positive patient. So yun po, I hope I answered the question po.
Okay. So, sana malinaw po yun, no, Sir Julius, no? Yung after po ni Nurse Venus. So, ibig sabihin pala, Nurse Venus, kapag halimbawa, alam mo na naka-close contact mo yung tao na lumabas na positive siya, so dapat agad-agad din ikaw mag-quarantine. Tama po ba? Nung mag-self-quarantine ka na on your own. So, huwag na hintayin pa na magkaroon na...
Yes, ma'am. Opo. It is talaga responsibility of everybody.
Yeah. Oo. Basta nalaman mo na positive yun, so ikaw na mag-self-quarantine, no? Huwag na hintayin. Tama. Okay. So let's now proceed to another question here. Ano po ba daw ang dapat na inom vitamins para lumakas ang resistensya? From siguro gusto niyo malaman kung anong specific na vitamins ang mas magandang inumin sa panahon ngayon.
For the vitamins, ang talaga is for the immune system, ang vitamins po natin is vitamin C. There are studies na zinc also helps with immunity po. So there.
Yeah, okay. So vitamins with zinc. Ang multivitamins, Doc,
C and zinc.
Possible ba? Okay ba yun?
Yes.
C and zinc ang mas maganda.
Yes.
Okay. Okay, thank you, Doc.
500 milligrams vitamin is also complete.
Okay, Doc. So noted on 500 milligrams of vitamin C na zinc, yun yung mas nire-recommend sa ngayon, no? And then another question from, is it ma'am or Sir Wine Espiritu? Okay. Kung may nag-positive na isa or tatlong empleyado sa isang government agency at nag-request po ang iba pa na magkaroon sila ng test pero ayaw ng head, ano po daw ang dapat gawin? Yan. So, magandang question din po ito, no? Kung may nag-positive nga naman daw po na 1 or 2 employees sa isang government agency, I mean, siguro sa isang opisina or sa isang school or sa isang office, at nag-request daw po yung iba, ay siguro ang tinutukoy ng mga employees, no, na magkaroon daw po ng test pero ayaw nung mismong head. Ano daw po ang dapat gawin? So anyone po from our resource persons, Nurse Venus or Doc Jen?
Okay. If, kasi upon discretion din yan ng doctor. Okay? Depende sa diba may mga category kanina na pinesend si Ma'am Venus regarding sa priorities natin, may symptoms yung close contact, tapos yun nga, may symptoms and then close contact ka, you can subject yourself to the RT-PCR test type.
Yes, Doktora, medyo Alright, sige po. Doktora, Nurse Venus, can you turn over to answer the query? Ayan, siguro nahihirapan po ang ating mga resource person sa kanilang mga bahay na makakonect sa internet. Sige po. So, let's check po yung iba po mga questions dito. Okay. So may nagtaman here na mas effective daw po ang swab test para makadetect ng COVID-19. Ayan. So then, please elaborate more on the mutation as well as the airborne. Okay, thanks po from Carmencita Divina. I think nandito na po ba sila Doc and Nurse? Doc Jen and Nurse Venus, nandito na pa kayo? Hello?
Yes, ma'am. Nandito na po ulit.
Hello? Ayan, okay. So, meron ditong tanong, no, bago natin, balikan natin yung mamaya, no, yung na earlier. Pero, eto muna, no, meron tayo ditong question from Ma'am Carmencita Divina. She is asking daw po to elaborate what is mutation. There's Venus.
Yes po, ma'am. Narinig ko po. Ano po ulit yung question?
Apo. Can you elaborate daw about the mutation that you have discussed earlier?
Okay. Yung sa mutation po, I will ask po Doc Jen if she would want to explain it po further. Doc Jen?
I'm back. Ano po yun, ma'am?
Okay, can you elaborate daw po what is mutation you are discussing earlier daw po?
Yes. Yung
That's from
mutation na...
Carmencita Divina.
Okay. Yung mutation na sinasabi kanina is yung nagbago yung parang components ng virus, making it more, based sa studies ko making it more easier to, parang more contagious kumbaga. Mas mabilis kumalat. Yun po yung sinasabi nila mutation. Though it's still under studies po, hindi pa proven na may mutation po talaga.
Okay. So I hope Divina is clear na po. So you can post sa ating comment section for follow-up. So, Doc, go back po tayo doon sa question earlier, no, from Ma'am, kung daw po ay nagkaroon ng positive sa atin sa isang school or sa government agency, pero ayaw po ng school, ng head ng office kung ano dapat gawin, pero nagre-request na raw po ang mga employees.
Yes, yun nga po, based nga po dun sa presentation kanina ni Ma'am Venus, may prioritization po ang pagtetest po ng isang patient, exposed individual. First po, symptomatic po ba tayo? May symptoms po tayo? If yes, most likely you should be subjected sa test po. Another is yung degree po ng exposure natin. Saka yung time duration since the exposure. If more than 14 days, hindi na po natin kailangan i-test. If less than 14 days since exposure and may symptoms tayo, kailangan po natin i-test. If wala naman pong symptoms, pwede po, depende sa na CHO din natin na i-test tayo or observe na lang for 14 days. If warranted po talaga at kailangan tayong matest, it's better po na magpa-consult tayo sa private doctor natin or primary care physician para mas directed po yung treatment at saka management sa inyo po based sa mga sa history at saka physical examinations po.
Okay, sige. Thank you, Doc. Another question here po, bago po yung question na yon, no, merong comment po from Ma'am Socorro. So it's really hard to have relatives infected with COVID-19. No, I think it's 19. The stigma that comes with the disease is really depressing. Thus, it is very hard for those infected to easily come out in the pen. So, talagang kung tayo siguro yung first na magkakaroon ng COVID-19, no? Kung tayo na sa kalagayan nila, ng mga positive, talagang makakaramdam po tayo ng ganoon na pain or nahiya tayo na mag-come out din, at lalo na kung may relative din tayo. That's why we are doing this series, no, para magkaroon ng more awareness. Tama po ba, Ma'am Lea, di ba? Ito po yung mga ginagawa natin to ease po yung ating mga nasa loob, no. It's really hard at first, pero once na nandun na tayo sa level na we are accepting, diba? Sana pumunta tayo doon sa level na yun, no? Huwag tayo maging stagnant na in denial tayo, na nahihiya tayo. So let's face the reality. We have to say din, no, na tayo ay nag-positive, so that yung mga nakasalamuha natin ay magkaroon ng additional prevention or caution sa kanilang sa mga nakasalamuhan nila. Okay? So thank you, Mama Giao, for that comment. And another question here, gaano daw po tayo kahanda sa SDO kung ang guro ay nag-positibo sa COVID-19? That's from Sir Anthony X. Gaano daw po tayo kahanda sa SDO kung sakaling may positive daw na teacher po natin or personnel ng COVID-19? I think Doc can answer this query. Doc Jen? Okay, so wala si Doc Jen. Nurse Venus, can you say something about this? Ano daw po tayo kahanda in the STO kung meron daw nag-positive na teacher po natin sa COVID-19?
Okay po. So, before ko po sagutin yan directly, I believe naman po, before pa we all went back, bago po tayo napunta sa GCQ, the STO has been preparing po protocols for the offices and for the schools po para sa kahandaan po sa pagbalik. So, nandun po dun sa infection prevention policy po natin, kung ano po yung mga dapat gawain in case po na nagkaroon po ng cases, sino po ba ang paano po yung referral system po kung paano siya. So in terms of po kung dun sa readiness na side, I believe naman po na we are kasi even in po sa DO naman we have been implementing po yung mga safety protocols, nag-disinfect naman po tayo. So I believe kapag bumalik po tayo dun sa face-to-face mode of learning, i-implement din naman po natin siya sa school. Tapos if ever po na may pag-positive na teacher, so susundin po natin yung protocol as per the guidelines of the Department of Health. So the STO would be the one to facilitate po the referral of the teacher and then mag-help out po for the contact tracing para to prevent then the spread within the school and the immediate communities po. So yun po.
Okay, so thank you, Nurse Vernon. Another question here. Ano daw ang estimated cost ng test from J. Galang? Sa tingin ba natin ay mahal po ba itong test na to or how much ang cost ng test na binanggit po natin kanina, Nurse Venus?
Naku ma'am, actually, honestly speaking, wala po akong ideya. Pero as per what I have heard from the news po, parang it ranges. May mga, the RTPC subsidy po ang PhilHealth doon eh. Ang alam ko, so hindi siya, kung ikaw ay PhilHealth member naman, parang may subsidy naman siya. So hindi mo naman siya lahat babayaran. The problem kasi is we are also purchasing po, the government and the hospitals, they are also purchasing po yung mga ginagamit natin. Kaya talaga medyo expensive po siya. Tama po ba ako, Doc Zen?
Regarding, ano po yun, ma'am? Sorry, kakabalik ko lang.
Yung amount, Doc Jen, yung amount daw po ng tinuturok po or yung test natin,
Yes.
sorry. Yung test po ba ay mahal po ba siya? How much yung cost?
The PCR, the swab test ranges from, if I'm not mistaken, 3,000 to sa Manila po umaabot ng 11,000. Dito sa Batangas parang 11,000 if I'm not mistaken. Yung ano, depende po sa institution. Yung pinakamura pong nakita po
sa institution,
is,
no? Especially
yes, ang pinakamura is 3,000 parang sa ano pa siya, sa PGH siya.
Oh. So it's very expensive po talaga magpa-test pa lang. Ano, ako parang magkakasakit ka lalo kasi very costly po ang test para sa COVID-19. And to the fact na tayo lahat ay magpapatest, I think kakayanin na ating pondo, no? So we need to have a memorandum of agreement or support from other agency or government institution para po dito kasi medyo mahal po pala siya. And declaration facility daw po ba na nakahanda sa mga kaguruan kung sakaling magpositibo sa COVID-19? Salamat daw po, according to Sir, and hindi. Okay. So meron bang tayong facility? I think, Sir Anthony, meron tayong facility na ginagamit. Yun yung pong nasa
Kanusa, ma'am, at saka
may
SciTech.
additional pang facility. Yeah. And yes, Doc Jen, can you elaborate po?
Regarding sa isolation facility, so far sa ngayon, ang Santa Rosa, ang isolation facility nila is yung SciTech at saka Canosa, if I'm not mistaken. Yun po yung mga isolation facility or quarantine facility na ginagamit po ng city.
Okay, thank you so much, Doc Jen. Another question, bago kasi mawala tong sila Doc Jen at si Nurse Venus. Mga mga 3 to 4 questions that we can entertain. Hi po, explain daw po, what's the difference between the SIM COVID-19 at yung pangkaraniwan na ubo or allergies pa lamang? From Ma'am Ernie May Franco.
Yes. If it's allergic, episodic usually, depende sa exposure natin kung saan yung allergen natin. If allergic cough yun. COVID-19, kasi it's a viral infection yung COVID-19. So, yung symptoms niya is parang almost the same with other infections, buong katawan nararanasan natin yung symptoms. But the difference with the pangkaraniwang ubo or allergies, transient yung at saka milder symptoms ang nararamdaman natin if it's yung pangkaraniwan or allergic in nature.
Okay. Sige po. And then from Ma'am Arlene Escobedo, kung sakali daw po tayo or guro na nagpa-positive, no? Meron po ba tayong matatanggap na ayuda, ganun po ba? Or support from government or from, and that's also the question of Ma'am Hazel Lebri. Then?
Yes. Support. Okay. Nagkakalabas lang po natin ng isang division memo on yung support na ng mga magpo-positive. And if I'm not, kung tama po yung pagkakaalala ko, that in coordination with PhilHealth, tsaka if may pondo po tayong mabibigay, may support po matatanggap. Nasa division memo po na recently released lang po.
Okay. So, thank you, Doc. Another, may recommended po ba kayo na online doctors since scary ang pagpunta sa hospital po ngayon for check-up?
Marami
In
pong
case daw po na natatakot sa doctors.
Yes. Marami pong online platforms ngayon yung mga doctors wherein pwede po tayo ng online consult. If natatakot tayo na pumunta ng hospital for check-up, we can set an appointment first sa mga doctors po natin if kailangan po natin ng consult. Para assured po tayo na hindi po lesser yung exposure natin. And meron din naman po mga hospitals na hindi rin po tumatanggap ng COVID-19 patients. Kung may symptoms sila ng cough, colds, hindi po nila ina-allow na pumasok sa nila since yung mga smaller hospitals or clinics po. May mga private clinics naman po yung ibang doctors wherein we can set an appointment with them po.
Okay, sige. Thank you, Doc. So I think, Doc, pwede rin naman nila tayong i-reach out. Tama po ba? Through message po ng health section na Facebook page po ninyo, no? Pwede rin po sila doon magtanong. Tama po ba?
Yes. If may questions, yes. If may questions po kayo or may kailangan po kayong i-consult, you can reach us po sa official Facebook page po ng health section po na i-flash ni Ma'am Elaine po. Or email
Yes,
us
oo.
po.
Okay, so mamaya i-flash namin. Tama po yun. So another thing here is from kay Ma'am Kai Dala. Kai, is it a girl or boy? Doc, sa ngayon daw po ba pwede mag-vaccination or pwede daw po magpaturo sila para sa pagpalakas ng immune system nila? Pwede daw po ba? According to Ma'am Kay Dala.
Vaccines. For ano natin is yung mga pneumococcal, yung for the respiratory illness, yun ay yung flu vaccine at saka yung pneumococcal vaccine. But generally, lahat ng vaccines po ay prevents us from getting the infection or yung getting the complications of the infection po.
Ayan. So, at least malinaw po na tungkol po sa vaccine natin. And then, aside from that, so that would be the last question po natin. Meron din po ditong mga nag-comment na salamat daw po for the very informative topic natin today. No, from Ma'am, nawala siya. From Ma'am Crispina, so much po. Na-appreciate po ninyo ang ating discussion for today. Meron din pong nag-comment. Okay. So may mga, yes po, no, we are experiencing internet connection a while ago, kaya pasensya na rin po. So hindi po natin minsan ma-hold, lalo na po pag live. Kaya medyo na-delay po tayo sa pag live stream. Okay? Yan. So Doc, I think meron po din dito nagtanong if pwede daw po kayo na magbigay sa kanila ng consultation o pwede sila mag-consult sa inyo for free. I think okay po yun kasi free naman po yun dahil kanina pinanggit po ni Doc na Facebook account nila na mamaya ipopost ko po sa ating live stream. Ayan. So, I think kung meron pa po tayong additional questions na kailangan po natin i-raise. Mamaya po magpo-post po ako ng email ads ng ating Dr. Jen and ng Nurse Benos para po dun sa mga questions na hindi po natin nasagot yung additional queries or follow-up. So, you can email them sa kanila mga DepEd email accounts. Okay. Yan. So, salamat po din to sa mga nakatutok po ngayon at nag-participate po sa ating discussion. I think Ma'am Leah have something to add on sa ating programa. Ma'am Leah, before this webinar for today.
Medyo nawawala ako. Naririnig niyo pa ba ako? Okay.
Yes, Ma'am Leah, go ahead.
Okay. Actually, this webinar nga, sabi natin is gusto nating ma-address yung mental health and psychosocial support ng ating mga teachers. Although maraming mga concern din po sila na hindi natin masagot sa ngayon dahil yung iba naman ay talaga nangangailangan ng mga tamang taong sasagot. So we have some limitations in answering some of the questions na nandiyan kayo. Pero maganda na nalaman namin yung mga concern din ng mga teachers natin at try natin yung best natin na matulungan sila dun sa ilang mga tanong na hindi natin nasagot sa ngayon. Ito pong ating mental health and psychosocial support program ay tuloy-tuloy po ito hanggang August. Marami pa tayong mga activities, part po ng ating learning continuity plan. So ito nga po, sana po ay nakatulong somehow sa ating lahat.
Okay, thank you so much, Ma'am Leia. And in addition to, no, magkakaroon tayo, Ma'am Leia, ng next episode, no, yung last episode for the facts
Yes,
ni
yung
my
last
peers. Baka pwede mo silang bigyan ng overview para doon sa susunod nating topic.
Okay, para sa next episode natin, medyo light yung ating topic next week. That will be about beauty and personal care naman amid the pandemic. So, tingnan din natin, baka marami kasi sa atin napapabayaan din natin ang ating mga sarili. Also, meron din tayong upcoming, I think, neurological healthcare na in partnership with Unilab. Marami po tayong makukuha doon at magbibigay din sila ng mga free I think neurological and psychological services. Yan. These are some of the activities that we have to look forward to.
Yes, tama ka dyan, Ma'am Leia. So, abangan nyo rin po yung susunod natin kasi celebrity doctor po yung naimbitahan natin for our next episode. At yung susunod naman ay in partnership with the Unilab. So, abangan nyo po yung more details po niyan. We will post the topics ay para po sa ating susunod na webinar series. Okay, so I'll be po yung ating queries kung saan po nila dapat i-email yung queries nila na hindi po na-mention or hindi po na-discuss kanina or nasagot. Sir Jason can post the slide. Yan. Okay, while waiting po sa ating post. Po, isulat po itong mga ating DepEd email ads ng ating dalawang resource persons po ngayon, jennifer.ramillo at 003@deped.gov.ph and yung isa po natin ay kay Nurse Venus po, yung venus.manalo at deped.gov.ph. Ramilo, 00, no? Meron din po tayo advisories and bulletins from school health section. So you can browse your Facebook accounts po and look for this account po ng School Health 24/7. Sabihin ay 24 hours, 7 days a week and someone will answer your fees at 049 health section or any one of us para po sa mga queries niyo with regards to the COVID-19 and other things na tungkol sa ating programa po, no, para sa mga division, teaching, and non-teaching personnel. Yan. So yan po, no, sana po ay nakatulong po itong hapong ito sa mga agam-agam po natin about the COVID-19. And of course, yung evaluation link po natin, okay, will not be posted on dito live, no? It will be posted po sa mga GCs po ninyo or through your DRRM coordinators and school heads, no? Po. Ibibigay po namin yung link at para po kayo magkaroon ng certificate for this webinar. Abangan niyo po later at ipopost po ng ating SMME yung ating link for today's webinar. Okay. So, salamat po uli sa inyo po. Any parting words po from our two resource persons po natin? Yes, Nurse Venus. Anything you want to add? Okay, so I think wala na silang effort para po mabigyan po tayo ng updates po here sa ating COVID-19, no? Yung mga Mhpss and Mhpss po, no, kung tawagin po natin. And also, we would like to thank po yung mga behind dito sa team natin. Nandiyan po ang Mhpss team, no? Ang gumawa po ng ating infographics, ang ating SMN or Social Mobilization and Networking EPS 2 na si Sir Louis Saldivar, Ma'am Leia, no, for additional inputs, no, from the DRRM din. In partnership po yan ng ating HRD, no, kami po sa HRDS ni Sir Perry Peria. And of course, yung SMME po nating dalawa, no, for providing us evaluation links for every webinar series na tayo. So, abangan nyo po yung susunod na webinar series po natin, ha. Kahit po nasa mga bahay po tayo at busy po tayo. So, makinig po tayo sa ating susunod na mga topics na i-discuss po natin. Thank you so much po, and this end, meron pala pong may pahabol pa pala po. So, yes, at dito po, no, to give us the closing remarks po. Syempre, hindi po paawat pang ating Schools Division Superintendent, si Dr. Manuela S. Yes, Ma'am Ella?
Good afternoon, everybody. Magandang hapon sa ating lahat. Binabati ko ang mga organizers ng ating webinar na ito. Siyempre, ang ating HRTD Elaine, ang ating nasa DRRM units, si Leia and the PDOs, si Kat at saka si Bane, tama ba ko? Perry. And then also yung ating mga speakers, no, naging speakers for this today's webinar. Maraming salamat kay Doktora Jen at kay nurse, sa ating nurse na naging speaker natin ngayong hapon na ito. Really, it takes time, no, and it takes courage to dwell on a very fair and smooth state of emotion amidst this time of COVID pandemic. Nagpapasalamat ako sa mga ganitong activities kasi kailangan nating alagaan ang ating mga sarili hindi lamang on the physical aspect, but also on the emotional and the effective mindset that we should have, in order for us to work harmony, to work at peace, and so that we could produce more. We have to be physically, emotionally, and mentally fit to our work. And as the theme of our training here, that you should not rely on hearsays, just like our ASDS, Lindo, has said and has explained to us a while ago, na we should believe on the truth, on the facts, and not to those who are spreading fake news and spreading rumors. Okay, I have a story about this kind of situation, and I am glad to share with you this story. And it is a very familiar story that we can apply on our own lives. An old man, a boy, and a donkey were going to town. The boy rode on the donkey, and the old man walked. As they went along, they passed some people who remarked it was a shame the old man was walking and the boy was riding. The man and boy thought maybe the critics were right, so they changed positions. Later, they passed some people that remarked, "What a shame! He makes the little boy walk." Yung tatay pinaglakad ang anak. They then decided they both would walk. Lakad na lang silang dalawa. Soon they passed some more people who thought they were stupid to walk when they had a decent donkey to ride. Nga ba naman naglalakad ang mga ito, meron namang masasakyan. So they both rode the donkey. Now, at this time, they passed some people that shamed them by saying, "How awful to put such a load on a poor donkey." The boy and the man said they were probably right, so they decided to carry the donkey. Sabi ng mga tao, ba't ba naman dalawang yung pinahihirapan yung donkey, sumakay pang pareho? Eh di ang ginawa nila, bumaba at kinarga na ang donkey. As they crossed the bridge, they lost their grip on the animal and he fell on the river and drowned. So what's the moral of the story? Do not try to please everyone. You might as well kiss your ass goodbye. Diba? Do not believe on lies. Do not believe on somebody or telling you that this is good, this is bad, and this is not worthy. What are you going to do? Believe in yourself. Your self-belief, your self-confidence will make you emotionally fit, at yung paniniwala natin sa ating sarili na kaya natin na kahit ano ang mangyari, meron naman tayong mga mahal sa buhay na pwede nating makasama at meron tayong Panginoon na pwede nating tawagan sa lahat ng oras. So that is it. I hope that the essence of the training that you have had will be put into life, to your own family, to your own self, and of course, to the job that you are in. Okay? So I hope everybody will be fine doing all the things that we should do according to the will of the Lord. Thank you and good afternoon. Mabuhay kayong lahat.
All right, thank you so much, Ma'am Ella, for continuing inspiring us. Mahilig po talaga si Ma'am Ella na giving inspirational stories, no, for us to ponder, to reflect on. Okay, so I hope again na nagustuhan niyo po ang ating discussion for this afternoon. So you may post also comments kung naging maganda po ang ating discussion, so that we will also know what are your evaluations or what are your comments. And you can also evaluate po and post also comments sa ating evaluation link na will be provided to you by your school heads and DRRM coordinators po. Ipopost po ng ating SMME sa mga chat groups po natin. And for that, so we will now end our session, our webinar, episode 2 for this afternoon. Thank you so much and God bless us all. I'm your host for today, Ma'am Elaine Sangalang, signing off. Thank you so much.